My name is Dr. Carrie A Elk. I'm a psychotherapist, and I have been focused, my career and all of my work has been focused on researching a new treatment for post-traumatic stress disorder that works efficiently and eliminates triggers, not just treats symptoms. 3 years ago, I had cancer, kidney cancer, that was found by accident. And the interesting thing about that is I took care of my father who had cancer and who had died in my arms in my home of cancer the year before. The year anniversary, the very day, a year later, that my dad died of cancer, I got a call, and they told me that I too had cancer, a different cancer. When I was well enough after my surgery, I had kidney cancer, and they removed part of my kidney, and I was fine. After that, it's been 3 years. But when I was well enough to walk and go back to work, I prayed, and I said, okay, I'm here for a certain reason, because I shouldn't really be here. It was found by accident. So God, whatever you have for me to do, I'll do it. This is your time. This is not my time. And that day, I spoke with Military OneSource, and I ended up being a clinical supervisor at Military OneSource. You know, and they deal with all of the, a lot of mental health issues with service members and their families. About 8 months later, it became impossible for me to stay working there. I'm a single mom, and it was taking me away from my family. And I thought, well, God, why would you lead me to something that contradicts something else? And I know God doesn't contradict himself. So I ended up quitting because I thought, what do I do? My priority is my child. So when I sat at the manager's meeting and said, okay, well, I have to put in my 2 weeks. I have an announcement to make. They said, well, who are we losing you to? Where are you going? I said, I don't know that yet. I don't know that yet. But I know that this is not where I need to be, and I need to do something else, and I need to follow the priorities and take care of the things that I have. So 2 months after that, I got a call from the University of South Florida, and they said, Dr. Elk, we just got a DOD grant to study a new treatment for post-traumatic stress disorder in military members, but we don't have anybody here that's qualified that has military mental health experience. That's when I knew why I had been led to Military OneSource. I was going to need that later. And so I did the studies with USF, and the results are good. And during one of my presentations, where I brought in a veteran and his mother who'd been treated in our study, who now was no longer on medications, and it had a life again. This isn't treating PTSD and managing symptoms. This is a game changer. This is correcting traumatic memories so that they're not a problem anymore. With the suicide rate in veterans that we see, the divorce rate, the drug abuse, and even those that aren't going through those, they are having trouble sleeping and just living a whole life. And you know, I feel like I've said this in South Beach when I was presenting with the mayor down there. They were trying to bring PTSD awareness, and I said, here's the thing. As Americans, we always say, you know, our freedom and our protection, and we claim all of the benefits and all of the things that come out of someone's service, of our military members' service. We claim them as ours. That's all ours. Well, the PTSD is also ours. The sleepless nights are also ours. So we have to claim the whole thing. Here, where we are right now in Las Vegas, on Nellis Air Force Base, we did a satellite. In one of the first original studies, I chose one place to do a satellite study just to see how that would work out. And Commander Rojas here of the NOSC hosted us, and we did a satellite study here to see how it worked, and it worked out really well.